It is definitely a busy Tuesday morning here, but we are going to kick things off this morning with a wonderful message from the American Heart Association's Physician of the Year, Dr. Jennifer Mieres. Jennifer, thank you so much for joining us this morning.
Good morning. It's a pleasure to be here.
Now, this is obviously a very important topic, and I think one that we don't necessarily talk about as much with women. Tell us about how we can reduce stroke and the three important factors there.
So thank you for hosting the American Heart Association, American Stroke Association. You know, the American Heart Association would like us to know that chronic stress is linked to elevated blood pressure, and elevated blood pressure leads to heart disease and stroke. The good news is that by controlling your risk factors and by controlling chronic stress, you can reduce your risk for heart disease and stroke. And so we want women to know that most strokes are preventable by adopting healthy lifestyle changes and knowing your numbers.
Now, it is very important. I think as women, we tend to multitask and juggle on a daily and I'd say minute to minute, hour to hour basis. What would you say are some of the unique stroke factors for women?
So I think we now know that women who have had pregnancy-related complications, such as elevated blood pressure in pregnancy, gestational diabetes, eclampsia, preeclampsia, blood clots during pregnancy, these are women who, even after delivering a healthy baby, are at increased risk for heart disease and stroke. So strokes are seen much more prevalently in those women.
Now, would you say that these symptoms can be the same for all women?
Well, we know that each woman is different. You know, so knowing your family history of high blood pressure, of pregnancy-related complications, definitely important. But what is also, the evidence points to the fact that Black women, African-American women, we see a much higher burden of chronic stress, which has a profound impact on elevated blood pressure, so higher incidence of high blood pressure, and higher incidence of heart disease and stroke in Black and African-American women. And so the good news is that most of heart disease and stroke can be prevented. And so this month, we want women to be proactive, recognize that their health is their most important asset, that stress definitely, we cannot eliminate stress, but by controlling stress and chronic stress, we can prevent heart disease and stroke and control blood pressure.
That's a wonderful list. And would you say are there any other additional things we should be looking out for besides the things that you just listed?
So I think this month we'd like women to know that you should know that high blood pressure is preventable, but also know your heart healthy numbers. Know blood pressure, blood sugar, of course, include your family history, definitely cholesterol levels, and weight. And interestingly enough, we know that 80% of heart disease can be prevented by controlling risk factors. So we want women to know their numbers, take time this month, get heart screen, schedule time with your doctor. Up until the 14th, we know that women can go to a CVS Minute Clinic for free heart screening, and knowledge is power. And we know that once you control your risk for hypertension, for diabetes, and other risk factors, and control for stress, you can live a long, healthy life free of stroke and heart disease.
Dr. Mieres, it was just wonderful to speak with you. Tell us one last time where we can go for more information.
You can go to the American Heart Association GoRedForWomen.org, as well as you can go to stroke.org. Additionally, when you go to GoRedForWomen.org, you will see information about ongoing research trials by the American Heart Association. And we're encouraging women to join a lot of the research trials so we can get more information to understand the unique risks of heart disease and stroke in women.
Thank you so much, Dr. Mieres, for joining us this morning. I know I am definitely going to be monitoring my health as a means of staying on top of things. So go redforwomen.org. We are definitely thrilled to have you here with us this morning. Now we will be right back after this break.